All right, let's go. Number 10. Hippocrates and cancer surgery. The tumor removal documented in 400 BCE. In the 5th century BCE, on the Greek island of Kos, a physician named Hippocrates established a medical school that produced the most sophisticated body of clinical knowledge in the ancient Western world. The Hippocratic Corpus, a collection of approximately 60 medical texts compiled between the 5th and 3rd centuries BCE, contains case histories, surgical protocols, and diagnostic frameworks that remained in use in European medicine for over 2,000 years. What the corpus also contains, in the text known as On the Excision of the Fetus, and in several case histories in the Epidemics, is documentation of tumor removal.
Hippocrates described the surgical excision of surface tumors using iron instruments, applied poultices for wound management, and made a documented clinical distinction between operable surface tumors and inoperable deep tumors, a distinction that remains foundational in modern oncological surgery. This means that cancer surgery, the identification, physical removal, and postoperative management of tumors, was being practiced and documented in the ancient Greek world 2,400 years ago. But here is where the clinical sophistication becomes genuinely remarkable. Hippocrates also documented the concept of prognosis, predicting patient outcomes based on observable clinical signs. The Hippocratic texts describe specific combinations of symptoms, pulse characteristics, and physical examination findings that predict favorable versus unfavorable outcomes. This systematic approach to clinical prediction, formalized in the Hippocratic prognostic, anticipated the evidence-based prognostic frameworks that modern medicine developed methodically only in the 20th century. The Hippocratic Oath, still taken in modified form by physicians worldwide, is the most visible remnant of a medical tradition that was doing cancer surgery before the Roman Republic existed. The texts are in libraries and digital archives accessible to anyone. The clinical observations they contain are, in many cases, still accurate. We have been building on this foundation for 2,400 years and have not always acknowledged how high the foundation already was. Number 9. The Reparo Villabruna tooth, dental filling with plant material, in 13,000 BCE. In 2017, a team of researchers led by Stefano Benazzi at the University of Bologna published an analysis in PLOS ONE of a human molar from a site called Reparo Villabruna in northeastern Italy. The molar dated to approximately 13,000 years before present, from the late Upper Paleolithic period. The analysis revealed that the tooth had a cavity, and that the cavity had been filled, not with metal, not with modern composite, with bitumen, a natural tar-like substance, combined with plant fibers and hair. The filling was deliberate. It was placed specifically within the cavity. The composition suggested it had been heated to make it workable before application. This is the oldest known dental filling in the human fossil record, by approximately 7,000 years. But here is where the clinical thinking behind it becomes significant. The person who filled this tooth understood at minimum the following: that the cavity was causing the patient a problem, that the cavity was accessible and treatable, that a specific material could be introduced into the cavity to address the problem, and that this material needed to be applied in a workable state and would harden in place. This is not instinctive behavior. This is clinical reasoning. Identifying a problem, selecting an appropriate material, applying a technique, achieving a result. In 13,000 BCE, someone in northeastern Italy was doing dentistry. The tooth is in the collection of the Natural History Museum of the University of Bologna. The filling material has been analyzed and confirmed. The tooth is approximately 13,000 years old. The cavity is filled. Number 8. Mehrgar dental drilling. Perfect molar drilling in 7,000 BCE. In 2006, a team led by Roberto Macchiarelli at the University of Poitiers published an analysis in Nature of human molars from a Neolithic site called Mehrgar in what is now Pakistan. The molars dated to approximately 9,000 years before present. 11 teeth from 9 individuals showed evidence of drilling, circular holes in the crown enamel, with tooling marks consistent with a rotary drilling instrument. The holes were 0.5 to 3.5 millimeters in diameter, between 0.5 and 3.5 millimeters deep, with smooth internal walls indicating a controlled drilling motion. No fillings were found in these specimens, but the drilling appears to have been performed on living patients. The teeth show signs of wear after drilling, indicating the patient survived and continued using the teeth post-procedure. 9,000 years ago, in a Neolithic village in Pakistan, someone was drilling teeth with rotary instruments. But here is where the clinical context deepens. Mehrgarh is one of the oldest complex settlements in South Asia, dating to approximately 7,000 BCE. It predates the Indus Valley civilization by several thousand years. The dental drilling at Mehrgarh was not an isolated experiment. 11 teeth from 9 individuals represent a practice with multiple cases, suggesting a practitioner with accumulated experience and a repeatable technique. The instrument used was almost certainly a bow drill, a device that converts the back and forth motion of a bow into continuous rotation of a drill bit. The bow drill was available in this period and region for working wood and stone. Someone adapted it to dentistry 9,000 years ago and used it successfully on multiple patients. The molars are in the collections of the University of Poitiers. The drill holes are measurable and photographable. The bow drill that produced them has been gone for 9,000 years. The evidence it left behind in human enamel has not. Number 7. Otzi the Iceman's acupuncture. Tattoos on exact traditional Chinese medicine points. In 3300 BC, on September 19, 1991, hikers Helmut and Erika Simon were descending from the Fintelspitz Peak in the Alps near the Austrian-Italian border, when they found a human body emerging from glacial ice. The body was eventually dated to approximately 3300 BC, making it the oldest naturally preserved human body in Europe. He is known as Otzi the Iceman. Otzi carried a copper axe, a bow, arrows, and a sophisticated kit of medical supplies including medicinal mushrooms, Piptoporus betulinus, known to have antibiotic and laxative properties, and Fomes fomentarius, useful for starting fires and potentially for wound dressing. His last meal has been analyzed and included ibex meat, red deer, einkorn wheat, and various plants. But here is the finding that altered the standard account of medical history. Otzi has 61 tattoos. When researchers mapped the tattoo locations against the acupuncture point charts of traditional Chinese medicine, a medical system documented in texts dated to approximately 200 BCE, the correspondence was striking. The majority of Otzi's tattoos are located at, or very close to, acupuncture points used in TCM to treat the specific conditions that analysis of his skeleton shows he suffered from: lower back pain, knee pain, and ankle problems. Traditional Chinese medicine's systematic acupuncture point mapping was documented approximately 3,100 years after Otzi died. Otzi's tattoos align with those points. Either the correspondence is coincidental, which is possible and contested, or systematic knowledge of specific body points with therapeutic relevance to specific conditions was present in Alpine Europe 3,300 years before it was codified in Chinese texts. Otzi is in the South Tyrol Museum of Archaeology in Bolzano, Italy, preserved at -6 degrees Celsius in a purpose-built refrigerated chamber. He is the most extensively studied human body in archaeological history. The tattoo correspondence to TCM acupuncture points has been documented in peer-reviewed literature and is genuinely not fully explained. Number 6. The Neolithic amputation at Bouthier-Boulancourt. Clean surgery with bone regrowth. In 7000 BCE, in 2022, a team led by Miriam Heidel at the Senckenberg Research Institute and Maxime Remigero at the University of Paris published findings in Science Advances concerning a skeleton excavated from a burial site at Bouthier-Boulancourt in northern France. The individual, dated to approximately 7,000 years before present, was male and had survived to adulthood. His left forearm had been amputated, not lost in an accident, surgically amputated. The analysis of the bone showed that the cut had been made at a specific level on the radius and ulna, the two bones of the forearm, with a sharp instrument, cleanly, in a single procedure. The bone ends showed extensive healing. The cortical bone had remodeled, New bone had formed at the cut surfaces, and the individual had survived the procedure by several years at minimum, based on the degree of bone regrowth. A successful surgical amputation, meaning the patient survived the immediate procedure, survived infection, and lived for years afterward, was performed in Neolithic France approximately 7,000 years ago. But here is where the medical implications become significant. Successful amputation in a pre-antibiotic, pre-anesthetic context requires control of bleeding, prevention or management of infection, and management of pain sufficient for the patient to survive the procedure. The 7000 BCE date predates any written documentation of surgical technique by thousands of years. The practitioner who performed this surgery had knowledge, whether empirical or transmitted, of how to accomplish all three of these requirements. The skeleton is in the collections described in the Science Advances publication. The bone regrowth is photographed and measured. The surgery happened. The patient lived. The knowledge that made it possible left no other documented record. Number 5. Trepanation at Ensisheim. Brain surgery in 7000 BCE with patient survival. In 1991, archaeologists excavating a Neolithic cemetery at Ensisheim in the Alsace region of France uncovered a male skeleton dated to approximately 7,000 years before present. The skull had 2 holes in it, not trauma holes, surgically cut holes. Trepanation, the deliberate removal of sections of the skull to expose the brain. Both holes showed bone regrowth at their edges. The patient had survived not one, but 2 separate trepanation procedures. The degree of healing suggests survival of weeks to months after each procedure. Trepanation is the oldest documented surgical procedure in the archaeological record, practiced on every inhabited continent from the Neolithic period onward. The Ensisheim skull is among the oldest confirmed cases of successful trepanation with documented survival. But here is where the question of what they were doing becomes genuinely interesting. The clinical indications for trepanation in ancient contexts are debated. Modern surgical trepanation is performed to relieve intracranial pressure, blood pooling under the skull after head trauma. The Ensisheim individual shows no skeletal evidence of head trauma that would explain the procedures. Either the procedures were performed for a medical indication we have not identified from the skeletal remains, or they were performed for ritual or therapeutic purposes that the Neolithic practitioners believed were medically justified. What is not debated, the procedures were performed. The patient survived them. Twice. The practitioner who performed them in 5000 BCE, without metal instruments, without anesthesia as we understand it, and without knowledge of germ theory, achieved a clinical outcome, surviving trepanation, that medieval European surgeons routinely failed to achieve 6,000 years later. The skull is in the collections of the Musée d'Alsace. The bone regrowth is visible and documented. The patient's name is not recorded. The knowledge of the practitioner who kept him alive is not recorded. The evidence that the knowledge existed and worked is in the bone. Number 4. Prehistoric herbal anesthesia. Mandrake, henbane, and opium in Bronze Age surgery. In 2021, a team led by Vanessa Linares at the University of Tel Aviv published findings in the Journal of the Institute of Archaeology of Tel Aviv concerning plant residues in Bronze Age ceramic vessels from Tel Yehud in Israel, dated to approximately 1000 BCE. The residues included Hyoscyamus niger, henbane, which contains the alkaloids scopolamine and hyoscyamine, both of which produce sedation, pain relief, and at higher doses, amnesia and unconsciousness. This finding was not isolated. Multiple Bronze Age and Iron Age archaeological contexts across the Near East and Europe have yielded evidence of plants with anesthetic properties in association with surgical or funerary contexts. Opium poppy residues in Cypriot jugglers dated to the late Bronze Age, mandrake preparations described in Egyptian medical papyri, cannabis residues in Iron Age burials from Israel and Siberia. The specific alkaloids produced by these plants, scopolamine, morphine, and various cannabinoids, are still used in modern anesthesia and pain management. But here is where the evidence becomes clinically significant. Successful surgery requires pain management. The Ensisheim trepanation, the Neolithic amputation, the Bronze Age dental procedures, All of these required the patient to survive procedures that cause extreme pain. Without effective pain management, patients die from shock. The survival evidence in the skeletal record implies effective pain management. The archaeobotanical evidence identifies the specific plants that provided it. The Bronze Age practitioners were not guessing. They had specific plants with specific alkaloids producing specific clinical effects. The pharmacological knowledge embedded in that practice, which plants, in what preparation, in what dose, for what procedure, was accumulated empirically over generations and represented a genuine pharmacopoeia. The pharmaceutical industry still synthesizes derivatives of the same molecules. The plants that produce them were being used in surgery approximately 3,000 years ago with documented effectiveness. The specific preparation techniques, doses, combinations, administration routes are the part that was not adequately recorded. Number 3. Peruvian skull plates. Metal inserts in surgical skull defects from 2,000 years ago. In 1865, Ephraim George Squire, an American diplomat and amateur archaeologist working in Peru, recovered a skull from Inca-era burial contexts that showed a rectangular hole in the frontal bone, approximately the size of a large postage stamp, with edges that showed healing and bone remodeling. The hole had been filled with a metal plate, apparently of gold or silver, fitted to the defect. Subsequent archaeological work in Peru and across the Andean region has recovered additional examples. Skulls with metal plates fitted to trepanation defects, with bone healing confirming patient survival after the metal was inserted. The practice appears to date from approximately 400 BCE onward in the Andean context. The surgery required: successful trepanation, patient survival of the initial procedure, fabrication of a metal plate fitted to the specific dimensions of the skull defect, insertion of the plate, and patient survival for sufficient time to show bone response. But here is where the clinical sophistication becomes its most remarkable. Modern neurosurgery uses metal cranial plates, typically titanium, to repair skull defects after surgery or trauma. The clinical logic is identical to what Andean practitioners were doing 2,000 years ago. The skull defect requires structural protection that the removed bone cannot provide, so a rigid material of appropriate shape is fitted to the defect and secured. The Andean surgeons were doing cranioplasty, a procedure that European surgery did not document until the 16th century, and did not do routinely until the 20th. The skull that Squire recovered in 1865 is in the American Museum of Natural History in New York. The metal plate is no longer present. It was presumably separated during excavation, but the defect with its healed edges is documented and photographed. Additional skulls with intact metal plates are in Peruvian collections. The bone healing that documents patient survival is measurable and confirmed. Number 2. The Ebers Papyrus, the medical encyclopedia from 1550 BCE that describes 877 treatments. In 1872, Georg Ebers, a German Egyptologist working in Luxor, purchased a papyrus scroll from an Egyptian merchant who claimed it had been found in a tomb near the temple of Asasif. The scroll was 20 meters long and 30 centimeters wide, written in hieratic script, and dated by its writing style and content to approximately 1550 BCE. It is known as the Ebers Papyrus. The Ebers Papyrus describes 877 separate medical treatments across a range of conditions including infectious diseases, parasitic infections, skin conditions, eye diseases, gastrointestinal disorders, gynecological conditions, and surgical procedures. It includes prescriptions with specific ingredients, preparation instructions, dosages, and clinical indications. It describes the cardiovascular system, specifically the role of the heart in distributing blood through the body, with a degree of accuracy that anticipated Harvey's formal description of circulation by over 3,000 years. The treatments include preparations using honey as a wound dressing. Honey's antimicrobial properties are now well documented. Willow bark preparations. Willow bark contains salicin, the precursor to aspirin. Copper salts for wound treatment. Copper has documented antimicrobial properties. And preparations from aloe vera, garlic, and pomegranate, all of which have documented pharmacological activity. But here is where the Ebers Papyrus becomes something more than a historical curiosity. Approximately a third of the preparations described in the Ebers Papyrus contain active ingredients with demonstrated pharmacological effects in modern clinical studies. The Egyptian practitioners who compiled these treatments over generations of empirical observation had identified, through trial and error across centuries, which plants and minerals produced measurable clinical effects. They did not know the biochemistry. They knew the outcomes. The Ebers Papyrus is in the University Library of Leipzig, Germany, where it has been since Ebers acquired it in 1872. A digital facsimile is publicly available. The 877 treatments it describes span 20 meters of papyrus, written 3,570 years ago. The active ingredients in roughly a third of those treatments are still in use in modern pharmacy under different names. Number 1. Trepanation survival rates in the Inca Empire. Better outcomes than 19th century Europe. In 2018, a team led by David Kushner at the University of Miami and John Verano at Tulane University published a comprehensive analysis in World Neurosurgery of trepan skulls from Peru, spanning approximately 400 BCE to 1400 CE. The sample included 59 skulls from pre-Inca and Inca contexts. The analysis focused on a specific question: what was the survival rate? Survival was assessed by the presence and degree of bone regrowth at trepanation wound edges. Bone regrowth indicates the patient survived the procedure and lived long enough for healing to begin, at minimum, days to weeks, in many cases, months to years. The findings: the survival rate for Inca-era trepanations, from approximately 1000 to 1400 CE, was between 75 and 83%. 3 out of 4 patients who underwent brain surgery in the Inca Empire survived. Now for the comparison that gives this finding its full weight. During the American Civil War, 1861 to 1865, the survival rate for trepanation performed by trained military surgeons using metal instruments in medical facilities with access to whatever pharmacological knowledge 19th century medicine had accumulated was approximately 46%. Less than half of patients survived. The Inca were doing brain surgery with stone tools, without germ theory, without modern anesthesia, in the 14th century CE, and their patients survived at nearly twice the rate of patients treated by 19th century American military surgeons. But here is where the full significance descends. The higher Inca survival rate is not a statistical artifact. Kushner and Verano's analysis found a clear improvement in survival rates across the pre-Inca to Inca timeline. Earlier specimens show lower survival rates. Later specimens show higher ones. The Inca practitioners were learning. The survival rate improved over centuries of accumulated practice because the knowledge was being transmitted, refined, and applied with increasing effectiveness. The knowledge that produced an 80% brain surgery survival rate in 14th century Peru using stone tools was accumulated empirically, transmitted within a specific medical tradition, and was effective enough to outperform European surgery by a significant margin 5 centuries later. It was not written down in a recoverable form. The Spanish conquest disrupted the transmission chain. The specific techniques, patient positioning, instrument sterilization methods, pain management protocols, post-operative wound care, were not recorded in sufficient detail to reconstruct. What was recorded is the outcome: 80% survival. In the 14th century, with stone tools. The skulls that document this are in museums across Peru and in academic collections in the United States. The bone regrowth is measurable. The survival is documented. The knowledge that produced it is gone. If you want to see more videos like this, click the video on screen now and make sure to subscribe.